Programs unit here at SFU Woodwards. Welcome to the beautiful Javed Mofaghim Cinema. Tonight we'll be kicking off our discussion series in partnership with Pivot Legal Society with a discussion on health, harm reduction, and the law. Obviously, Insite was being discussed at the Supreme Court last week, and it's been a long journey in terms of the debate around harm reduction. I know that when, on a personal note, when I was finishing off university in the mid to late 90s, a number of people on the panel tonight, I met them at the time, people like Bud Osborne. I remember going to a heroin overdose conference with Liz Evans, and it's really great to be here in a university setting to be part of the kind of discussions that need to happen in the city, and we hope that SFU in the coming years in this space we will continue to do that. Also just wanted to recognize our sponsors beyond Pivot. We've relied on the help of a lot of volunteers and a lot of organizations, including the Urban Health Research Institute, CDPC, British Columbia Center for Excellence in HIV/AIDS, PHS Community Services Society, the BC Civil Liberties Association, and Megaphone Magazine. I'm just going to pass it on to Darcy Bennett from Pivot.
Hi, thanks so much, Am. Having worked with Pivot since 2006, I've sat in on a lot of discussions about Insite and the whole legal battle to keep Insite open. But as we started talking about Insite going before the Supreme Court, I realized there was still a lot about this case that I didn't understand. And it was kind of out of my ignorance that the impetus for this event sort of started milling around. As we started organizing, I was a bit relieved to know that I wasn't the only one who had some of these questions about what this case was all about, and what it might mean for Insite, what it might mean for other supervised injection facilities, and what it might actually mean for drug policy in Canada. Tonight, I think we're going to get some answers to those questions, but I think maybe even more importantly, we're going to hear about the journey of some of the people whose tireless work have made Insite the reality that it is today. But before we get started, I just wanted to introduce our moderator for this evening. Donald McPherson is a tireless advocate for evidence-based drug policy. He is the author of Vancouver's innovative 4-pillar drug strategy. He's also the director of the Canadian Drug Policy Coalition, as well as being the vice chair of Pivot's board, where he is an unending source of mentorship and support. So I'm going to hand it over to you.